My name is Dr. Kristi Prince, and I'm a naturopathic doctor in Coburg. A little bit about myself to now be back and practicing. So I'm part-time in Coburg, and then I'm also a full-time faculty member in Toronto. I work at the Canadian College of Naturopathic Medicine, where I teach and I supervise the future naturopathic doctors of tomorrow. So today I'm going to be talking to you about what I've come to know as the stress epidemic. And the reason that I think this is a really relevant subject nowadays is because stress is everywhere. And in one of my favorite books, Anatomy of an Illness, I was really intrigued to see it described as the most prevalent and serious health problem of our time. And this book was actually written well before the 70s, so even to know that then stress was a very big issue and it was very relevant is interesting to me, because I think that it is one of the underlying factors to many of the diseases that we see today, many of the chronic diseases, whether it be chronic coronary artery disease, diabetes, hypertension, depression, anxiety. And I do think to an extent that it is one of those factors that is very modifiable. So, a very relevant topic to discuss for your health and well-being, and also very applicable to naturopathic medicine. So, I have come to know that stress is absolutely an epidemic. So, just to give you a little bit of overview, when we're talking about stress in general, we're talking about the general wear and tear that life in general has on our body. And that can mean physical wear and tear, mental wear and tear, emotional wear and tear. And the stressors that we experience come in a variety of different types, sizes. So physical stressors are those things that are physical to the body. So the food we put in our body, I think many people don't recognize that if we're not eating the right food, that's causing a great deal of stress and consequently inflammation on the body. Physical stressors also include exercise, so too much exercise or too little exercise. Substance abuse, smoking, illicit drug use, alcohol. So I think when people think of stressors, those are the common things that they really do think about. But then we have this whole other realm of mental and emotional type stressors. So what our family dynamic is like, what our work environment is like, how we feel about ourselves, what our self-talk is like. Those are all sorts of stressors that we tend to place on ourselves. And as you can see here at the bottom, the reason that stress is so applicable and well treated with naturopathic medicine is that these stressors are so unique and they're so very individual to every person. So something that stresses me out is completely different than what stresses the other person out. And we all have our own very individual responses to how we adapt to and respond to stressful situations. So when we talk about stress, it's not always bad. There are good stressors. So stress in the sense of the word is good when it motivates you to do anything. It drives you to get up in the morning and to work really hard, whether it's at your job or at being a mom or a brother or a husband or things like that. Those can be really good stressors that keep us going. The bad stressors are more the ones that may be chronic, are the things that we tend to bury inside, how we deal with them, or again, those harmful type foods that have a big impact on the body on a physiological level. So, stress is a whole body response, absolutely. So we have the symptoms or the signs that we're typically used to when we're under a stressful situation. Our heart rate increases, we start to sweat, maybe our mouth gets a little bit dry. Those are our physical symptoms. But on a subcellular level, a lot is really going on as far as hormones are involved, and that can have a profound influence over time if the stressor is chronic and not removed. So just to give you a very simple breakdown of what happens when we're exposed to a stressor, there's typically a trigger, so something that we find is habitual and a very common theme in our lives that might cause us stress, or might be a physical stressor. And that sends a signal to the brain that says, okay, something's going on, we feel like we're in danger, we need to react. The impulse is sent to our autonomic nervous system, and from there it can either go into our parasympathetic, which is our typical rest and digest type state, which is the ideal. So this is when we're not stressed. But when we're in that more acute situation, our sympathetic nervous system is activated. and that really sends a signal to our adrenal glands, our pituitary glands, our thyroid glands to stimulate other hormones that help us to respond to those stressors. So, if we go to the next slide, this is your typical fight or flight response, so activation of the sympathetic nervous system. So our stress hormones are mobilized. Our cortisol, I think, is the best known hormone when we think of stress. And that causes our breathing rate to increase, blood flow from our muscles to increase, heart rate, blood sugar levels increase, blood pressure increases, I think we all know, and the blood is diverted away from other organs in the body, so our digestion or our brain and our ability to really think in that moment. So sometimes we act very impulsively, which can be good but can also not be good. So these are the general stages of stress. And I always like to educate my patients on these stages because I think it is very relevant for them to recognize what maybe stage they're in and how they can respond and what's going on a physiologic level. So the stage 1 reaction is your alarm reaction, and that's your very acute type onset of a stressor. So you're being chased by a tiger, and that is a very immediate threat to you. So you mobilize all the systems in your body, those hormones go crazy to give you that surge of adrenaline so that you can run away. We find that compared to our normal level of resistance and how resilient we are to stress, experiences a subtle little drop, but then it increases very rapidly beyond what we're normally accustomed to. This stage is not harmful inherently. If you use this excess energy in the form of, say, physical activity, so you go for a run when you're stressed at home, great, you're using up that energy. When it becomes harmful is when we allow those emotions or what we feel in response to that stressor to bottle up inside and we don't do anything about it. Then it has no way of letting the energy escape, so it starts to wreak havoc on our cells and our other organs, causing them to function at a suboptimal level. So after stage 1, the stressor is sometimes removed. Other times the stressor continues, so it becomes more chronic. And that's when we move into the stage 2, the adaptation type phase. So the stressor is still there, we're still functioning at this very high type frequency, but our body becomes habituated to the fact that maybe we're under stress. So I always show this to my students because I think this is the stage where they function at most of the time. They're doing assignments, they're studying, they're writing exams, they're seeing patients, and they're always under that go, 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 I have to keep going type phase. So to a point, your body gets used to that, and maybe you don't recognize you're under stress. When I talk about it with people, what are your stressors? They say, oh, well, there's work in this, but they're not really stressors anymore. They are still stressors because they're still doing something within your body. So this stage is manageable. However, this is ideally where we want to intervene. This is where talking about diet and nutrition is really paramount, where giving you or helping you to develop coping strategies and techniques is crucial so that you are helping your body to adapt to and respond to the stressors. When we move into stage 3, the exhaustion phase, this is where it gets very dreary and something I don't like to see people go into this phase. So we find that people function for so long at this high level, and then often you'll see these patients are the fibromyalgia patients, the chronic fatigue patients, people who are under a great deal of adrenal stress, and they're basically just feeling burnt out. I see a lot of people in this stage because, of course, we haven't been educated enough to recognize prior to this stage what we need to do. But it can be very, it can lead to death if you don't sort of take over. That's drastic. I don't really like having that on the bottom of my diagram, but it really is that crash, debilitating type phase. So you can't get out of bed, you have no motivation, maybe you're experiencing very low mood, depression, anxiety, other mental health disorders, so schizophrenia, bipolar, things like that. So that's absolutely the most harmful phase and where we want to avoid going. Okay, so the consequences of stress, whether they be physical, mental, or emotional, and over a long time, can lead to any and all of these conditions. and many more. I just couldn't fit any more on this slide. But I think the most well-known are obviously our high blood pressure, our anxiety, addictions as a means of coping with how we feel and that constant pursuit of trying to make ourselves feel better. Diabetes, absolutely, because you're having that chronic state of mobilizing blood sugar and really storing that sugar that you're taking into your body for energy, so you start to gain weight. We start to see, especially in the female population, because I do work with a lot of women, a lot of hormonal imbalances. So cortisol is chronically high, that affects their thyroid function, which as a result also throws off their estrogen and their progesterone balance. And ultimately you'll see people who are in chronic states of stress with immune dysfunction and also with complaints of fatigue, not so surprisingly. So, how does naturopathic medicine fit in? This is what I think is the best way to explain naturopathic medicine, and I know most people are visual learners, so go with me on this one. But naturopathic medicine is really the system of healthcare that works at addressing the root cause of why things are occurring. So rather than going somewhere and saying, you know, I'm having this pain, here I'll give you a painkiller, it's not about palliating those symptoms. It's about finding out why those symptoms are occurring and creating a management plan that really is individualized and unique for you and your life circumstance, and that also really addresses your goals. So all of the things that you see sort of above the soil are the things that we manifest on the outside. So anxiety, maybe we're overweight, maybe we're having skin conditions like eczema or psoriasis, maybe we're having crazy PMS or very irregular or painful periods. Libido, definitely sleep. These are all the symptoms, but they're not the cause of why these things are occurring. What's underlying all these issues I see is, yes, hormonal imbalances, environmental toxicity, which I think becomes more relevant nowadays when we look at, as we heard today, you know, like genetically modified foods and our go-go-go lifestyle that causes us to choose fast foods over home-cooked meals. Diet and lifestyle in general, food is not what it used to be, and I think a lot of times people go for the convenience factor over forgetting that food really is that main source of nourishing yourself, and it's a gift that you give yourself. Lifestyle, which involves stress management, alcohol, drugs, underlying infections. Medications are huge. As helpful as they may be sometimes, they also place a huge burden on the body, and they do have an effect on our cellular function and our ability to metabolize things and function, and also any degree of trauma, whether it's physical or emotional. So all of these things can be summed up as sources of stress. So when I say stress is an epidemic, it really is the #1 thing that I seem to find that underlies all health conditions, but it also acts as that main obstacle to cure, so to speak. So we can do as much as we can in office to correct those things with dietary supplements and acupuncture or herbs, but unless the patient is willing to share what their stressors are or learn to better cope with those stressors, then it can often be the thing that prevents them from experiencing the optimal level of health and wellness that they want. So naturopathic medicine operates on these 6 principles, and obviously the first is to do no harm. I think that's sort of continuous across all health professions, but basically really, as I said, works at identifying and treating the root cause of why things happen. It operates on the principle that we know that the body is the most intelligent being, and if you look at, you know, when you're a kid and you get a scab on your leg and you look at it every single day, it changes without any intervention over the span of a week. And that is what we mean by the inherent ability of the body to heal itself and support the healing power of nature. I love naturopathic medicine because it really does treat the whole person. And often the whole person involves their family and the communities that they live in, because those are all extraneous factors that can influence their health. Prevention of disease, I think, is huge, and that's where stress management comes in, because as we've seen, stress can lead to a whole variety of conditions that may otherwise be prevented. And then my favorite principle is doctor as teacher. So really putting yourself on the same level as your patient to empower them and educate them to realize that they have control over what they put in their body. They have control over what they do, and it's not about me, but it's about meeting you where you're at to help you meet your goals and give you those tools to take away and take care of your health on your own. So, with stress, why you would want to see a naturopathic doctor, they are a primary care provider. So for most of my patients, I am their primary contact for their healthcare needs. We are highly educated. We have over 8 years of post-secondary education. But we really are the practitioner that integrates your standard medical diagnosis, lab testing with evidence-based medicine. So what does the research show is the best indicated supplement for said thing. And we integrate that with natural therapies to address the root cause. I also like to say that I am a practitioner who help accommodate patients for their choice. So I'm a little bit of an advocate in the sense that they often come to me when they've been through the healthcare system and they say, you know, I feel like I'm not being heard, I'm not being listened to, but these are my goals and no one's meeting them. It's my job to meet those goals with you. I do provide a safe space and listen to patients. We have a long time together. The first time that we meet is about an hour and 15 minutes, an hour and a half, so that's a pretty decent time to get to know you. But then I really like the fact that I can empower and teach others and share my knowledge to better their health and well-being. So, how can we better work at coping with the stressors that are placed upon us? The reality is that stress is everywhere in this world, and none of us can live inside a bubble. If we did, that wouldn't be very much fun, and it just wouldn't work. So my role as far as stress and stress management goes is to give people the tools that put them at a lower risk of becoming susceptible to those stressors, who make them more resilient to standing up to stressors and whatever they may be. So I cannot emphasize enough the importance of nutrition. I think that is absolutely the foundation of any healthy person. And that means consuming a very well-balanced diet of whole foods. So really choosing organic when you can. Local, I think, is absolutely great. Not only does it support the people in your community, but it's also supportive of your health. And choosing things that are not genetically modified, obviously, are chock full of those good nutrients, vitamins, minerals, that make you resilient to stress and support those anti-stress pathways within the body. Ensuring adequate protein intake, and that doesn't necessarily mean meat. If you're vegetarian, it means other sources, so lentils, legumes, nuts and seeds, protein supplementation if required. Water, crucial to allowing your cells to function as well as they possibly can. And minimizing those really kind of crappy foods, for lack of a better word. So Coke, caffeine, diet pops with artificial sweeteners, really not a good option. And minimizing caffeine. I think I use the word minimize because not all caffeine is bad. A coffee once a day is not the end of the world. I'm talking about minimizing it to the point where you're not having upwards of 5, sometimes more cups of coffee a day that sort of keeps you functioning. Because I do think there is a lot of pleasure and there's a big social aspect that comes out of going out for coffee with a friend or having coffee with a family member. Avoiding those processed fast foods, so planning ahead. If you're going to be away and out, maybe you're dropping the kids off or something like that, really planning ahead so that you have snacks in your bag, snacks for them, snacks for yourself, so that you can keep yourself going. And that you don't skip meals, because we know that as our blood sugar kind of fluctuates throughout the day, we're more prone to going for those really quick options, and those foods, again, are the foods that cause inflammation and put extra stress on the body. I already said planning ahead. It also means appropriate supplementation as needed, and there's a lot of information out there. I just encourage people to supplement appropriately with the right product for them and at the right dose, because I see a lot of people who come into my office and they have a whole bag of supplements and they're really not necessary. A supplement is a supplement for a reason. It's meant to act as an adjunct to your diet and the nutrients that you're getting from whole foods. Exercise, again, is a big one. And when I talk about exercise, I mean happy levels of exercise, so not overdoing it. But generally 30 minutes of aerobic activity at least 5 days of the week. And then adding in other forms of exercise, so resistance. I think we saw Zumba this morning, which I think is awesome and fun, which is really important, and yoga. So that really, I call it yin type activity that really allows you to be present and allows your nervous system to just kind of mellow for a little bit is really important when we're so go, go, go. Choosing activities that you enjoy, and that can be with regards to exercise, but in general, because we know that when we have our happy hormones released, those are in a sense anti-inflammatory and they help to support our ability to respond to stress. And with regards to exercise, you know, finding a friend so that you can do it together and you can release your stress together. I know more people who go for a run after work with their colleague or their friend and they vent about the day so that when they get home it's not an issue and they don't bring it into the house. So that makes it for a happier environment for everybody. And then just being outside with nature, because I do find that coming back to the roots and being out in the fresh air and the sunshine really is something that grounds us and brings us back to that very parasympathetic state that we want to function in. Sleep is crucial and is very affected by certain stressors, but also lifestyle choices. And so to a very large extent, your sleep is manageable with regards to practicing really good sleep hygiene. So making sure you set a routine for yourself and give yourself that time before bed to really wind down and say, okay, body, I'm getting ready to fall asleep. Being consistent with when you go to bed and when you fall asleep, especially if you are someone who is a student or you have a busy family at home, really being strict about giving yourself what it needs with regards to sleep. Sleep in a very dark room to ensure that optimal levels of melatonin are produced, because that's your hormone that's going to keep you asleep. And I really, really encourage no work in the bedroom. So the bedroom should be a very serene and potentially intimate place, and you want to keep it that way. You don't want to bring your iPads in, you don't want to bring your cell phones in. You want to keep it as a place where you can go for relaxation and rest. And then avoid all stimulating activities before bed. So TV, news, really not a good idea, because often it gets us jacked up before we have to go to sleep, or worrying what else is going on in the world, because there seems to be so much going on nowadays. So really just, you know, coming down, maybe having a bath, reading a book, again, if it's not like some good mystery that's going to keep you going and going. And then natural sleep aids as needed. And I do encourage you to consult healthcare professionals prior to using any of those. Stress management as a whole. These are all tips and techniques for managing stress, but these are specific to organization and other little kind of miscellaneous categories. So time management and organization. If you plan for your lunch ahead of time, then that's not something you're going to have to think about the next day. Or encouraging your children, if you have them, to pack their bags the night before, so that when you go out in the morning, it's going to be a much more relaxed and pleasant experience for everybody, because they're not trying to find everything and you're not trying to run after them, in addition to looking after yourself. Developing good coping strategies, whatever they may be. And this, I think, is really important with respect to individualized care, because I have people who love yoga. That is the thing that they do. That is what helps them mellow and cope, and that's great. I have people who you cannot get to do yoga if you paid them $1 million, but that's okay, because it's not what works for them. Again, you have to work with your doctor to develop what fits with your lifestyle. Deep breathing, awesome. There's a lot of research to show that even 10 minutes of deep breathing a day, or 5 minutes when you're acutely stressed, can do 10 times more than any pharmaceutical to actually bring down your blood pressure. So it's a very simple but very big. Great is really that time for rest, making yourself be present with yourself, and really again function at that parasympathetic state. And then rest, relaxation, and vacations. I think those can't be forgotten, and in fact we should give ourselves permission more often to say, I'm taking tonight off, I'm not bringing work home, I'm going to go on a vacation this weekend. So give yourself permission to relax, because I think sometimes that in itself is an obstacle to achieving your health and wellness goals. And make time for you. socialize after work, socialize with a neighbor or colleagues or whatever, but that interaction that you get from other people is so crucial to your overall health and well-being. Scheduling time for play, whatever that might be. So activities that you really enjoy and giving yourself permission to experience those activities, I think, is really important. And also taking time for you, because I think we are a society that overnourishes others. We give at our jobs, we give at home, we give to our partners and our families, but we often don't take enough for ourselves. And really being okay with doing that is a good idea, because I always tell my patients, and this applies to even for me, I can only give as much care to others as I give to myself. So in our profession, we call it Dr. Heal Thyself. So just like people come and see me, I go see my own naturopathic doctor. But it's really important that you do take that time for yourself. And lastly, you can see a naturopathic doctor as well, because we do really operate on that, as I said, individualized treatment. The approach is really yours. You guide the treatment and you tell them where you want to go. So I think that that is a good option for you to have and to know about as well. So that's the end of my presentation with regards to stress. I'm happy to answer any questions that we might have right now. I think we have a couple minutes, but if not, I'll hang around for a little bit after. So.
You mentioned in stress to avoid sleeping in lighted rooms. And I'm curious about that, because I have no trouble sleeping wherever whatever the light is.
Yeah. And
what is the issue with stress?
With stress, so the issue with stress is more, if you're not sleeping in a dark room, then your levels of melatonin are not going to be secreted at as high levels as they should be. And that is your hormone that allows you to stay asleep and achieve those deeper levels of sleep that are necessary for rejuvenation and restoration and healing. So if people aren't secreting optimal levels of melatonin, or they're not sleeping as soundly or as restfully as they should, then it's going to mean that they may be more on edge. I know if I haven't had a good night's sleep, or I've compromised the amount of sleep I get, I am not so pleasant in the morning. I have more cravings for those really kind of sugary, carbohydrate-rich foods, which ultimately depress immune function, but also make you less resilient to stress overall.
Okay, thank you.
You're welcome. Any other questions?
What would it mean if you get lots of sleep, you sleep pretty well, but when you wake up in the morning, you could sleep forever, or you still never feel rested?
And that is, I would say more often than not, that is the issue with people. As soon as their head hits the pillow, they're out, they sleep, and they could keep on sleeping. So there's something going on a stress level where you're just so far into that adaptation phase, almost exhaustion phase, where there's so much more required to help your body to bounce back up and become resilient. So when I talk about those patients who have like fibromyalgia or chronic fatigue is the best example, they will sleep 3/4 of the day and need to sleep. They will go to the grocery store, and that in itself is exhausting, and they will come home and sleep for hours. So they're so far into that exhausted phase that simple rest for a normal, healthy individual that is restorative is not for them. So there's other things that you would need to do to be supportive, like focus on pacing themselves and educating them about really planning ahead for those rest periods, or having them remove themselves from the work environment because they just can't function in that sort of stimulation at that time. So it's more a case of being so far tired that it's such a deficit that it's going to take a while to get back up. Any other questions?
What about when you sleep? I have no problem going to sleep, but every couple hours I'm awake. What do you do with that?
Well, I guess it depends why you're waking up. So with, if I have people who have diabetes, or women sort of as they get older, or you're drinking a lot before bed and you're waking up to pee, then that in itself is a pretty good indicator that, you know, that's what you need to modify, whether it's not having your liquids before bed, or doing other things to support like urinary health or blood sugar levels so that that's not occurring. Other people just wake up for no reason, and that may be a matter of adjusting their sleep schedule. So maybe they're falling asleep really early on the couch, and then they wake up to something, if the TV's been on, and then they go back to sleep. Well, the whole cycle's thrown off in a sense because they've already probably woken out of that deep stage of sleep, and so they're coming in and out of those levels. A lot of time our neurotransmitters, which are influenced by hormones, are not at optimal levels. So they cause us to wake up, and they prevent us from going into those very deep levels of sleep. So there's many different factors in which a whole sort of case around that and looking at all those factors would have to be addressed.
So if you're in chronic pain, you can never ever actually achieve REM sleep, or to the extent of sleep that you would require?
I would say if you're in pain, and I see a lot of chronic pain patients, specifically in the college in Toronto, but the pain is often that obstacle that prevents them from sleeping. They'll roll over and it's excruciating, so they're not getting into that deep level of sleep. Or even people have like sleep apnea, they just wake up several times a night for whatever reason and can't achieve those levels. So yes, and when you're not getting that sleep that's not restorative, then you're going to experience more pain because your body needs those deep stages to heal and for the pain to improve, essentially. So in those patients with chronic pain, addressing sleep is a big, big priority.
Would you tell people not to watch the fear-driven news because it seems to have a huge effect, and most of it is bad news and not the good news of what's going on in the world?
Yeah, and that's a good question, and I feel like I connect to that because if I watch the news and something goes on, then I find that I'm on edge. If I'm on the subway or something like that, I'm definitely more on edge. Whereas if I had never seen the news, I'd be totally okay. So I think, again, it comes to that individualized approach where you have to look at their overall personality. And if there is someone who you're working with to treat anxiety, then yes, perhaps removing some of those stimulants or those triggers would be relevant. Otherwise, if it's someone who, they see something every once in a while and it kind of throws them off, not such a big deal. But prior to bed, I don't think it's a good idea because then you start ruminating about it and you're never going to get to sleep. Okay, so I think that's all the time that we have. Thank you very, very much. And if you need to talk to me, I'll stick around a bit, but there are some handouts about stress up here if you desire, in addition to my cup. So thank you.